Hello friends, if you or a loved one has been diagnosed with a brain tumor, brain metastasis, trigeminal neuralgia or another complex condition inside the brain, you may have been advised to consider gamma knife treatment. And naturally, you may have questions. Is this open brain surgery? Will the skull be open? How effective is the treatment? How long is the recovery? And why are international patients traveling to India for advanced radiosurgery? Today I will explain what you need to know about gamma knife treatment in India. Despite its name, gamma knife is not actually a surgical knife. There is no traditional surgical blade and no large incision. Gamma knife is an advanced form of stereotactic radiosurgery designed to treat selected abnormalities inside the brain with very high precision. The system directs many highly focused beams of gamma radiation toward a precisely defined target. Each individual beam contributes only part of the total dose, but where the beams converge, they deliver a concentrated therapeutic dose to the abnormal tissue while limiting radiation exposure to surrounding healthy brain structures. This precision is especially valuable when treating lesions located deep within the brain or close to critical structures. Gamma knife may be used for several carefully selected neurological conditions. These include certain brain metastases, meningiomas, and vestibular schwannomas. It also treats acoustic neuromas, pituitary tumors, selected skull-based tumors, and certain other intracranial tumors. It may also be considered for vascular conditions such as arteriovenous malformations or AVMs, and for functional neurological disorders, particularly trigeminal neuralgia. An important point is that gamma knife is not appropriate for every brain tumor or every neurological condition. Suitability depends on factors such as diagnosis and tumor size, location, number of lesions, previous treatment, and the patient's overall health. That is why expert evaluation is essential. The treatment process begins with detailed imaging. This may include MRI, kinetic scanning, and in selected vascular conditions, angiography. A multidisciplinary team then creates an individualized treatment plan to identify the exact size, shape, and location of the target. Depending on the gamma knife system, a stereotactic head frame or specialized immobilization system may be used to maintain absolute accuracy. The treatment is then delivered according to the personalized plan. For many patients, gamma knife is performed as a short stay procedure. The patient lies on the treatment couch while radiation is delivered precisely to the target according to the plan. Treatment time can vary depending on complexity, but importantly, there is no traditional open surgical incision. Many patients return home the same day or after brief observation. Potential advantages include no open brain incision, no large surgical wound, and usually a short hospital stay with a rapid return to routine activities. This approach provides highly precise radiation delivery with reduced disruption of surrounding healthy brain tissue. However, side effects and risks can occur, including swelling or radiation-related tissue changes. The risk profile must always be discussed individually for your specific condition. Gamma knife has been used internationally for decades. For many selected benign tumors and metastases, local control can be high. For trigeminal neuralgia, many experience pain relief. For AVMs, treatment may gradually close abnormal blood vessels over time. But there is no single success rate. Outcomes depend on diagnosis, lesion size, location, and previous treatment. India has become a major destination because patients can access experienced neurosurgeons, radiation oncologists, and advanced radiosurgery technology. International patients also receive support with medical visa documentation, airport assistance, accommodation, and hospital coordination. Cost is another major consideration. In high-cost healthcare systems, gamma knife treatment can cost tens of thousands of dollars. In India, treatment broadly ranges from $5,000 to $7,500 US depending on the hospital and complexity. Recovery is often relatively rapid. Many patients can walk shortly after treatment and return gradually to normal activities within a few days. But the therapeutic effect is not always immediate. Tumors may shrink gradually, and follow-up imaging is essential to monitor response. Gamma knife radiosurgery is a major advance, offering highly precise treatment without conventional open brain surgery. The most important question is not simply is gamma knife available? The real question is it the right treatment for your specific condition? If you have been diagnosed with a neurological condition, you can share your MRI reports and medical records with our team for specialist review. We can help you understand suitability, expected outcomes, and the next steps. Thank you for watching, and we wish you the very best in your recovery.